my goal in sharing my story, beyond education and empowerment and advocacy, is just to hopefully be a part of closing this disparity gap that exists in breast cancer for Black and brown women. So when I speak, I hope that I am informing and empowering a woman who might find herself wearing the shoes of a patient. I hope that I'm getting a physician or a surgeon to think differently about their approach to the care of a breast cancer patient. And I'm able to just, show up in a different way, even in my own practice of medicine. The disparity gaps that we see in the Black or African American community around breast cancer are huge, right? There's this 40% mortality or increase in mortality of 40% for Black and African American women, and a lot of other disparities. And I think apart from the systems issue around healthcare, the issue in our community is just a lack of understanding of our risks. We may not know our family medical history because of, again, health disparities, or because it may be taboo in certain cultures or certain communities to talk about it, or, you just don't discuss your business. And so we have these layered issues that prevent us from even being aware or having an understanding of what our needs are, or what we should be concerning ourselves with, or what we should be seeking medical attention or routine screening for. I always tell people that I was healthy until I was not, right? But I throw air quotes when I talk about being healthy, because I was healthy by medical standards. I didn't have a diagnosis. I didn't need to take medicine every day, but I was really unwell. Simple things that we take for granted, like getting enough sleep, drinking enough water, moving our bodies every day, just the power of a 30-minute brisk walk every day, how impactful and beneficial that is for our health. What we eat, is so important, but not just what we put into our bodies, what we put onto our bodies. I am a huge proponent of self-breast examination. I've been doing my own self-breast exam since I was about 20 years old. And it was a routine self-breast exam that led me to being in the care of a breast surgeon and a medical oncologist prior to my cancer diagnosis. So I really encourage women and men to know their bodies, to perform monthly self-breast exams, and to really look for those changes. One of the things that we forget is that not every breast cancer is going to present itself as a lump or a bump that you feel. We have to visually inspect and examine our breasts. We have to be mindful of the sensations that we feel. Most breast pain will not be cancer, but sometimes breast cancer is painful. And I had this very subtle pain right in the area where my breast cancer was ultimately diagnosed. But no one really talked about that or asked a lot about breast pain or discomfort. And so, doing our self-breast exam is more than just what we, touch and feel on any given month. It's what we see in the mirror. It's skin changes, it's changes in temperature, it's, nipple discharge, it's bleeding, it's so many things. And so I just really encourage people to be very mindful of their breasts, but nobody will know your body as intimately as you do. And so self-breast examinations are critically important to our health and well-being. I would say one word that describes me today is empowered. I would say it describes me today because when I didn't know what I didn't know, but really needed to know and could have benefited from, I wasn't empowered. I wasn't in a position to advocate for myself the way I needed to. And today I'm empowered to do that and to help other women do that as well. So today I'm empowered.
Natrelle breast implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.